Pre-donning instructions. Ensure the healthcare worker is hydrated. Tie hair back. Remove jewellery. Check your PPE is in the correct size and available. Hospitals need to identify areas for safe donning and doffing of PPE. Now clean your hands with alcohol hand gel or rub. First, unfold the coverall and undo the central zip. You then need to insert both of your legs into the coveralls. And then fasten the zip up to 5 centimeters below your neck. Donning or putting on your respirator. This must be the respirator that you have been fit tested to use. Position the upper straps of the respirator on the crown of your head above the ears and the lower strap at the nape of the neck. Perform a fit check. For a valved respirator, inhale sharply. For an unvalved respirator, exhale sharply to tense. If you cannot obtain a good fit, do not proceed to enter the patient area. Don your eye protection. A visor is recommended. If not available, use goggles or a reusable eye protection. Optional step. Put on your apron if needed. An apron is only needed in addition to a coverall or fluid repellent surgical gown if you're doing sessional work. The apron and gloves must be changed for each patient seen, but the same gown or coverall can be used for several patients. If you are doing sessional work such as a ward round and there is an AGP risk for the entire bay or hot zone, you must wear a fluid repellent surgical gown or coverall along with an apron worn over the top. Now clean your hands with alcohol hand gel or rub. Put on your gloves. Make sure that these are the correct size for your hands. Ensure the gloves fully cover the cuffs. Keep your hands away from your face and the PPE being worn. Change your gloves regularly when torn or heavily contaminated. Limit surfaces touched in the patient environment. Perform hand hygiene regularly. Doffing or taking off the personal protective equipment. Remove your gloves. Do not touch the outside as these may be contaminated. Now clean your hands with alcohol hand gel or rub. Remove your disposable apron if worn. Do not touch the outside as this may be contaminated. Now clean your hands with alcohol hand gel or rub. Use both hands to remove the visor or goggles. Grasp and hold the elastic headband with both hands. Stretch it out, lift and pull away from the face. Discard after use as infectious clinical waste. Now clean your hands with alcohol hand gel or rub. Put on a clean pair of gloves. This is in case you have inadvertently touched the outside of the coveralls. Remove the coverall. This should be done from top to bottom. Tilt your head back and gently feel for the zip, and with one hand pull the coveralls away from your body. With your other roll the coverall from the waist down and from the inside of the coverall down to the legs, past the knees to the top of the shoes, taking care to only touch the inside of the coveralls. Finally, step out and away from the coverall. Carefully gather up the coverall, touching only the insides of the coverall, and dispose of the coverall as infectious clinical waste. Dispose of the fresh pair of gloves as infectious clinical waste. Now clean your hands with alcohol hand gel or rub. Remove your respirator. Do not touch the front as it may be contaminated. In the absence of an anteroom or lobby, remove your FFP2 or 3 respirator in a safe area, e.g. outside the isolation room or patient area. And discard as infectious clinical waste. Immediately wash your hands with soap and water. You have now completed the doffing or taking off of PPE for aerosol generating procedures for hospital clinical staff, Coverall version.